Taking care of pets within one's home is an activity that maintains order within the living space, as it is categorized as an instrumental activity of daily living. Veterinary visits ensure proper health and well-being for the animal, which is important in taking care of a pet. The veterinary visit experience requires several tasks and demands be completed efficiently in order for one to provide appropriate care for their pets. Sequencing is important when completing the veterinary visit experience to ensure each task is completed to the ultimate benefit of the client and the pet.
Avery, time for the vet. Where are you? Come here. Come here. All right. Put you in your carrier. Here we go. All right, let's go.
There are a lot of interactions taking place while you engage in the activity of taking your pet to the veterinarian. It is important to note that an activity can be defined as a general idea about a category of action, in this case, a veterinary experience. This activity is included in the instrumental activity of daily living occupation of taking care of a pet. While an occupation can be described as an activity with meaning to someone, there are several aspects of the occupational therapy domain that can positively or negatively affect participation, including activity demands, context and environment, client factors, performance skills, and performance patterns. These aspects impact and are impacted by the veterinary visit. Social demands change between each visit as you may speak to a variety of staff. Various appointment schedules affect timing, and the context of the visits occasionally change. Several modifications and adaptations are possible within this activity. If someone was having difficulty completing the activity, as mentioned previously, adjusting appointment times could have many benefits to effectively completing a veterinary experience, such as an earlier time and fewer clients, or a later time that accommodates work hours. If someone was struggling with transportation or social interactions, social and space demands could be modified by a mobile or in-home veterinary visit. Preparing for a conversation with your veterinarian can decrease social anxiety difficulties.
Hello, how are you?
Hi, good. How are you?
I'm good. Who do we have here?
Avery.
Awesome. And what's your name?
Haley.
The doctor will be with you in 1 second. You can just go ahead and take a seat in the waiting room.
Thank you.
Haley and Avery, You guys can come back with me. All right. Hi, Avery, how you doing? Is there any particular reason you're bringing him in today, or is it just a checkup?
Flea treatment and a checkup a little bit.
Sounds good. Well, it looks good to me. I'll go get the vet, and we will be right back.
All right, come up here. We're waiting for the vet. You're gonna get your flea treatment. Now be a nice and no bug boy. I wonder how many of these is too many. Hello. Come here. Hi.
Hello there.
Veterinary visits involve a lot of social interaction and communication skills. There is often a lot of information being exchanged between the vet and pet owners.
It is. Kind of good in your mouth, little Avery. Kind of good in your mouth.
One must have the ability to listen to the veterinarian intently, engage in conversational turn-taking, as well as respond to and ask questions when necessary. These skills must be performed all while looking over your pet to make sure they are safe and behaving appropriately for the vet.
Do you have any concerns for Avery?
No, not right now.
Well, he looks great. He just got his flea treatment and should be good for about another 6 months.
Awesome.
Thanks for coming in, little guy. Thanks for coming in, you cutie.
Well,
And then these are for you.
awesome. Thank you.
You guys are all set.
Thank you.
Have a good day.
Grading allows an occupational therapist to increase or decrease the demands placed on the client based on the specific deficit of a social anxiety disorder. Upgrades to this activity can be made by searching for specific things to talk about prior to the appointment to increase the instances of initiating conversation. Occupational therapists could also have the client interact with other pets in the waiting room, giving greater opportunity to connect with other pet owners. Downgrading options include informing a close friend or family member of the appropriate information and having them take your pet to the vet, or the client could request to pay inside the vet exam room to decrease verbal communication at the front desk.
All right, is Avery doing good?
Yeah,
That's
great.
great. All right, your total is going to be $80 today.
There you go.
Thank you. It's okay, you're almost done.
Almost home.
And here you go.
Thank you.
Have a great rest of your day, guys.
You too.
If an occupational therapist has a client with decreased participation throughout the veterinary experience, they can utilize observe the individual in this situation as an assessment tool to identify possible dysfunction areas. An OT can then use an appropriate intervention, such as modification or adaptation, by using this observation as a therapeutic tool. This allows the OT to meet with the client to identify their strengths, weaknesses, and goals related to a more satisfactory veterinary experience.